Hello, my name is John Lynch. My partner, Emily Grice, and I interviewed Dr. Wendell Holmes, an orthopedic surgeon, about why he chose to be an orthopedic surgeon, what advice he has for future surgeons, and the ulnar collateral ligament reconstruction surgery, which is also known as Tommy John surgery.
I grew up playing sports and was very active, and by the time I was 19, I'd had knee surgery and a cast on every limb, so I didn't know who my pediatrician was, but I knew who my orthopedic surgeon was. So I identified with them, and then it just ended up when I went to medical school, I kind of knew I wanted to do orthopedics. Make good grades, learn a lot in school. If there are things that interest you, kind of follow your passions. There's a little bit of a road to get into orthopedic surgery. You got to do well enough in college to get to med school, and then orthopedic surgery, unfortunately, is a relatively competitive subspecialty. So even after completing medical school, you've had to do well in your class to qualify for an orthopedic residency. So my best advice is make good grades. Don't worry about 8 years from now, right this minute,
So why would someone need Tommy John surgery? If someone is having chronic elbow pain and is unable to warm up when they are throwing, they may have a UCL tear. This happens from repeated stress and overuse, which Dr. Holmes will explain on the next slide. If a patient presents with these symptoms, the orthopedic surgeon will perform a clinical exam and order an MRI to determine if the UCL is in fact torn.
When I was growing up, I played baseball. I was a good baseball player, but I played for 3 or 4 months a year, maybe a little extra in the summer, and then in fall and winter you played a different sport. Now the baseball players will play 8, 9, 10 months a year, and it's the UCL injury, that Tommy John's injury, is an attritional injury. One of our terms is cumulative microtrauma. You're gradually traumatizing over time, and it's not one throw that tears the UCL, it's the last 1,000 or 10,000 throws that did it.
For the procedure itself, the patient is positioned in the supine position with the arm out, the injured arm out. The orthopedic surgeon will then remove the palmaris longus tendon from the forearm. He will then make 2 holes in the medial elbow with a drill, the medial elbow being on the inside elbow when the arm is hanging down, and 3 in the ulna elbow, which is the elbow when the arm's hanging down, which is on the outside. The tendon is then woven through the elbow in a figure-8 pattern. Then the surgeons will suture up the elbow incision, which will leave about a 4-inch scar. To prevent infection in this surgery, as any surgery does carry a chance of infection, antibiotics may be prescribed. Also, the surgery is near the ulnar nerve, so neuropathy, pain, numbness, weakness in the arm is possible from this surgery. The surgical team for the UCL repair consists of an orthopedic surgeon, like Dr. Holmes, an assistant surgeon, a circulating nurse who makes sure the operating room is sterile, a scrub nurse who makes sure all the proper equipment is ready for the surgeon, and an anesthesiologist. The anesthesiologist has to make sure the anesthesia won't react with any of the patient's other medicine. So a thorough record of the patient's medicine must be completed. He or she also monitors the lungs of the patient, because the lungs do not operate the same under anesthesia as they do when someone is not under anesthesia. All team members for the UCL repair surgery must follow national patient safety goals that are set by the Joint Commission, and they must also follow regulations that are set by the Orthopedic Surgical Manufacturers Association. For the surgery, the UCL instrument set has the drill bits and guides needed to be attached to a power drill to drill into the elbow. Power drill, you can see right here, has got its long shaft going into the medial elbow. Forceps are used to remove the palmaris longus tendon and guide the tendon in a figure 8 pattern. A scalpel is needed to make the incision to remove the tendon and also the incision at the elbow itself. Retractors, there's one pair spread out wide here and one pair spread out thin by the drill here, are needed to keep the incision open during surgery, and sutures are needed to close the incision once the surgery has been completed. After surgery, a dressing will be applied with a splint, like the one this man in the button-down shirt has, that keeps the elbow bent at 90 degrees and keeps the forearm neutral. After 10 days, the splint is removed, and a brace that allows more movement is placed on the patient so he or she can begin rehab. The rehab after UCL repair surgery consists of reestablishing the range of motion in the elbow and also re-strengthening the elbow. For someone to get back to a competitive level after UCL repair surgery, the rehab takes 12 to 15 months.